Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We are discussing Chhardi Vyadhi, and on the background of the Chhardi Vyadhi, we have tried to elaborate different principles of the Chhardi. The first one was the patient complaining about just getting vomiting sensation but not expelling anything out, and patient feels that if I vomit then I will feel better. This is the first. So in that case you have to give bala to that urdhagati of the dosha. So it is just like inducing vaman process. This is the first case we have discussed. Second case we have discussed that the patient is already getting vomited, and you will find that it is a sama chardi, and if the sama dosh are getting expelled out of the body, then upeksha do not disturb, ignore, and just wait until all the sama dosh are expelled out. Third patient says that I am already exhausted by vomiting, I can't tolerate. In that case you have to give shaman chikitsa. Now the fourth one, which I forgot to explained in last lecture, that there is gati bhed. The dosha gati is urdhva, and so make it downstairs. So there is another treatment we can suggest to the patient is virechana. So the urdhva gati dosh, because of virechana there is gati bhed and chardi is reduced. Now you have these four patients of chardi. The next important question is how you will decide that of these four principles of chikitsa we can apply to any patient. How you will choose the exact principle? How will you give shaman chikitsa? Will you give virejan chikitsa? Will you give induce the vaman chikitsa and give doshagati the bala? And about samadosh. Now when you are going to select one of these treatment, you have to focus on which factors. First is rugna bala. If patient is alpa bala, alpa sattva also mentally, then you have to go for the shaman chikitsa, because the patient's bala is so alpa that you can't induce vaman, or if vomiting is going on the patient will not tolerate that. And so in that case, or patient is getting frightened because of alpa sattva, then in that case you have to give shamana chikitsa, and the medicines you can choose anything, tanudalu, suchakar, shankhavasma, etc. Second thing, vyadhi bala. If samata is on the higher side, and you will find that patient's tongue is coated and all the lakshana of ama are present in the body, then you have to convince the patient that let the vomiting go on. In this case you will have to give assurance to the patient that if the sama dosha are getting expelled by a natural way, then let them go out of the body. Now patient is alpa bala, alpa sattva, and there is sama dosh, and patient says, in spite of all other your logic of sama dosh, I will not, I want this vomiting to be get stopped. In that case you have to give the medicines which will be amapachak and also chardigna. So in that case the kalpa like lagu suchekar, etc. are very much useful. Now in which patient you will try to give dosha bala strength. It means in which patient the patient is saying vomiting sensation and it is getting but not getting expelling, not getting the vomiting actual. So in that case also you have to think of the rugna bala first, physical as well as mental. If patient is tolerable to vomiting, it may be 2 or 3 times or 4 times, whatever it is, then only you can go for the Vaman Chikitsa, and in that case again you have to give ask the patient, give him all the things what you are going to do, and then perform the Vaman. This also indicates the same indication in the case of viration. If you have to give viration as a chikitsa by the principle of gati bhed of dosha, then also it's a part of panchakarma. Then also you have to assure the patient that you will have loose motions, and if the patient is ready for that, then only vaman or viration what is appropriate for you, you can choose as a treatment. So you have four patients of Chardi in front of you. In that case, you have to think of the Rudabala first. If Rudabala is okay, physical as well as mental, you can go for Vaman or Virechan. Also, you can ignore if the Sama dosha are getting expelled out. If dosha Rudabala is Alpa, Sattva is also Alpa, then instead of getting Vaman or Virechan, you have to think of the Shamana Chikitsa at any cost. In spite of Rugna Bala, Vyadhi Bala, if the patient is already getting vomited, though it is Sama dosh are getting expelled out, but if you find the symptoms of Rasakshay by any means, then in spite of any other principle, you have to stop the vomiting at any cost, because that Rasakshay may give other complications in no time. So, whenever you are choosing these principles of treatment on the same Chhardi Vyadhi, Rugna Bala, Vyadhi Bala is important. Third important thing is history of the patient. If the patient says to you that the vomiting, in spite of all pathyas and good Rutucharya, Dinacharya, I am getting constant vomiting, then you have to think of the other diseases. They may be surgical, like intestinal obstructions, appendicitis, or whatever it is, or even tumor in the stomach or any unknown srotas, and that's why that tumor is obstructing the making sotoro and getting chardi. So if the chardi, in spite of all the proper dinacharya rutucharya, is recurrently occurring in the patient, then you have to think of the some test, maybe sonography, endoscopy, scan, whatever it is, because it denotes that there is something different problem than normal chardi of say amal chardi, etc. As I said, explained in the first lecture of chardi, the Dvishtarthaya chardi. Now, what is the hetu in the Dvishtarthaya chardi? That it is a some rotten food, rotten smell. Indriyartha is bad, which has been consumed by the patient. So, Viparit Chikitsa, if the bad smell has occurred, you have to give good smell. If the bad food has been there, you should go for the good taste food, etc. And along with that, you have to give Shaman Chikitsa to stabilize the patient. Now, in the Dvishtarthaya Chardi case, always remember Hetu Parivarjan is the main thing, because if that bad smell is in contact with the patient, he will get vomiting naturally, recurrently. So, in Dvishtarthaya Chardi, you can shift the patient to the good artha, or at least get Hetu Parivarjan first and then go for the Shamana Chikitsa, because as I said, in Dvishtarthaya Chardi, artha is the karan, and there is no much more Sanchaya Prakop Prasar or Doshoklesha as such in the body. So you can go for the Shaman Chikitsa immediately. In the case of, there is another type, Daurudaya Chardi. It is a gynec matter, and it is for the first trimester it is normal, and if it persists after 3 months of pregnancy, then you have to think of the Chikitsa. In that case also there is pregnancy. So Vaman Virechan, to be frank, I will suggest to avoid them, and Shaman Chikitsa will be the best choice in spite of that Amaja or whatever Niram Chardi, whatever it is. So in Daurudaya Chardi, it's a very different chapter. In that case, you have to even give Shaman Chikitsa, or if it does not get cured or cushion, then refer to the gynecologist, as it is the specialty area. So this is about the Chardi, and I have tried to elaborate the different principles of Chikitsa on the background of the same disease. Thank you very much.